Liposuction has been around for probably close to 30 years now, and it's done by making a very small incision so there's hardly any scarring and inserting an instrument called a cannula that's hollow. It's got little openings on the end, and then the other end attaches to a tube which goes to a vacuum. That's run back and forth. Little tiny clumps of fat are pulled out, and you stay working on one area when you've either reached the contour that you're looking for or simply no more fat is coming out. The ideal candidate for liposuction is someone who's young, healthy, has very elastic skin, they're close to their ideal body weight, they just have a few bulges that they want to get rid of. Because that patient, you take that fat out, the skin snaps back, it tends to be very smooth and looks like they've never had the operation done. Not everyone has to be the ideal patient, but the closer you are to that, the better results tend to be. The fat that's removed during liposuction is permanently removed. You don't grow new fat cells unless you were to gain a tremendous amount of weight. But if you gain weight, fat is going to go someplace. If we do liposuction on the stomach and we've removed most of those fat cells, someone gains weight, some of it will go to the stomach, but most of it's going to go someplace else. Maybe it's the buttocks or the thighs, something like that. Occasionally a woman will have a situation where they have liposuction done, they gain a little bit of weight, and the only place it knows to go is to the breast. And that's why some people say their breasts get bigger after liposuction. It actually can happen. Recovery from liposuction tends to be very easy. The scars are very small. We're not operating on muscle, which tends to be more tender. So patients are back to doing things very quickly. I typically see patients at about 3 days. The stitches that I put in the incisions are removed, and they can be back to activities very quickly. Working out, a lot of times patients will have liposuction on a Thursday and they're back to work or almost full activities by Monday.